I'm Dr. Bill Adams. I'm a plastic surgeon in Dallas, Texas, associate professor of plastic surgery at UT Southwestern Medical Center, and the program director for the Aesthetic Fellowship. I'm also the current president of the Aesthetic Society and past president of the Aesthetic Surgery Education and Research Foundation. You're listening to Interview with the Surgeon Agent.
Hello, everyone, and thank you for joining Interview with the Surgeon. Today, we welcome Dr. Bill Adams, president of the Aesthetic Society and also the director of the UT Southwestern Aesthetic Surgery Fellowship. Doc, how are we doing today?
Doing excellent. How are you?
I'm doing wonderful. Thank you for being with us. So kind of getting started, what were your goals and aspirations during your residency, and how did those change throughout your fellowship?
Yeah, well, I mean, I went from Vanderbilt Med School, which is where I spent 4 years, and I knew things. I wanted to be an orthopedic surgeon initially, and then it turned into, I found that I really liked other areas of surgery better, and particularly plastic surgery. But it was a little bit of a jump to go to where I went to the typical pathway for plastic surgery is 5 years of general surgery, and then two or sometimes 3-year fellowship. At the time, it's mostly 2-year fellowships. But there were 3 programs that were doing this combined, what now is called integrated plastic surgery programs. So there were 5-year programs, but then you did general surgery and plastic surgery. So I ended up being fortunate enough to get into one of those, but it was a little bit of a jump because a lot of the traditionalists would say, no, you don't want to do that. You're not going to be a good surgeon. And I think we've learned that's not necessarily the case. I think actually you concentrate more on what you're doing when you do the integrated residencies. So I think they're excellent. But so that was the first thing. It was like, okay, am I doing the right thing? But yeah, I mean, when you go into a program, Parkland Hospital was a fantastic combined residency and fellowship, because the way Parkland General Surgery worked, you were really the chief when you were a 3rd year. So we did kind of 3 years of 3 years of general surgery, but it was a little different because we had interspersed in there some electives, like, we had like orthopedics or neurosurgery or oral surgery or ENT, so we were doing in plastic surgery. So we were getting some of the subspecialty stuff, but still getting a lot of operative experience and patient care experience. So it was really fantastic for integrated or combined residency. And then we moved to full-time plastic surgery. And I actually did a research fellowship in between. So I ended up doing, my total time was 6 years. But, I think once you figured out it was a pretty good situation, it was just like, you're pretty much engulfed in learning to be a surgeon and learning to be a good doctor. And, you don't really know what's going on outside. There might be a bunch of things going on, 9/11, other things, and you barely know they're there, but you're just in the hospital all the time. So, but it was, I wouldn't trade it for anything. It kind of shapes you into who you are as a person. And certainly I think those residencies, particularly the end of it, in plastic surgery at UT Southwestern, it was a very, people call it intense. I guess it was intense, but that was just kind of who we were. We worked hard, but it was a great education. We worked with some fantastic mentors. They emphasized aesthetic surgery quite a bit at UT Southwestern. Has always been the case. And so, I think that shaped a lot of my kind of subsequent aspirations to do what I ended up doing. But, that's all, that's what happens in your residency.
So during your fellowship, you're going into the job search process for the first time. What was your mentality like, and how that perspective changed in the beginning years of your career?
Yeah, well, I kind of have had a hybrid career, because I went from a training, I went full-time. I was full-time faculty at UT Southwestern. I had people, even in med school, I had a couple of my mentors that really said, oh, you should do academics. So I kind of always had that in the back of my head. But UT was a very academic place. We worked with a lot of really well-known, excellent surgeons, good academicians. Our chair was Rod Rourke, and Fritz Barton was just the immediate past chair. Steve Bird, Craig Hobart, a lot of these guys doing a lot of different things. John Tebbets at the time was not on faculty anymore, but he was around and another big mentor of mine. But yeah, I mean, so I went in to academics, and it was like, wasn't like we were sitting around baking cakes. I mean, I worked harder when I went into practice than I did my residency, and so it was just pretty full throttle. But we were very driven. We were given some really, I think, fantastic opportunities by a lot of our mentors in terms of being able to get into, say presenting at meetings or writing papers or doing research, and that's the thing. You really want to support some of the younger people as they come up through. And we were certainly supported. Myself and a couple of my colleagues were supported. But I think you earn that. It wasn't like people handed stuff to us on our platter. We worked really hard, and I think we did a good job. We took care of patients well, and we treated the residents well. And we were good educators, and that's how you grow. But as you asked the question, so I didn't know exactly what I wanted to do at the beginning. I just knew I really thought plastic surgery was great. We did tons of, it was Parkland was we worked a lot at Parkland, but we also had our developing kind of private end of the academic practice. We did a lot of microsurgery and trauma surgery and replants and all this stuff, and it was just we thought it was great. Now you talk to me if I do microsurgery or something, now I'm like, oh my God, like it'd kill you. But it was fantastic starting out, and then we were writing a lot of papers and doing a lot of research. So, at the time, I was doing all that, but I knew as time went on and we started getting a few more junior faculty in who were taking over some of that workload that we initially were doing, then you start thinking, okay, what do I really want to do? And I had done quite a bit of research, particularly in breast implant aging, capsular contracture. That really was kind of the two areas that I had done. And those are the type of things that kind of shape your career, because you get into a certain subject, you do research, you learn about it, you're treating some patients, you become a subject matter expert, and then that's what you end up doing. And so for me, that was kind of the turning point after doing some research and doing things, and then really starting to focus on some of that. And I think certainly in the environment of where I was at UT Southwestern, aesthetic surgery, some places aesthetic surgery is frowned upon, which is ridiculous, because now it's, I think, the most rapidly growing area in medicine, or one of the most rapidly growing areas of medicine. But certainly at UT, it was not. It was actually there's people who were visionary, people like Fritz Barton, who really kind of started that trend of emphasizing aesthetic surgery education in our residency. It was not frowned upon at all, and so we started developing initially, for me, breast reconstruction practices, and then aesthetic breast practices, and kind of dovetailing in some of the research I'd done on capsular contracture and other things like that. And so, and then it was, I went part-time at UT after in my 9th year. So 8 years full-time, then part-time. And so I was private practice, part-time at UT, and that's actually still where I am today. Although I'm getting more involved in UT because I'm the program director of the Aesthetic Fellowship now, and but that's been great for me, and I've really focused on a certain area of plastic surgery now, and even for the past 10 or 15 years, really more aesthetic breast and body has really been my area that I've concentrated on. And I think that's a good way to go. Stay a little more general initially, and then you can focus in on what you feel like you have the most interest in, and maybe have done some things to kind of be an expert in. And I think that's a good way to do it.
What would you say were some of the keys to your success that shaped your early career as you're able to reach the success you've reached to today?
Well, I think, it's a simple formula, right? You don't want to be an ass. You want to be a person that it's felt to be you work hard, and you kind of do what you say you're going to do, and you take good care of patients. You try to make a difference, but you got to be a team player, and I think that's we learned that early on. I think that's how you survive sometimes in residency, but I think in life that's also important. And then you also have to develop some things outside, the hospital or outside your work. You can't work all the time, and so I think we had a good balance. And I think that really helped shape, my career. Some of the relationships you make, whether it's within plastic surgery or outside of plastic surgery, those kind of personal friendships are kind of at the end. Everybody says like when you die, it's not, nobody cares how hard you worked, and that may or may not be true, because obviously it does shape kind of what you do and maybe where you end up in life. But also there's stuff outside work is important, your family, other things like that, and so all those things shape your career, and it's probably different for everybody. I would say, everybody probably has a little different pathway there, but you definitely need to have some focus, and probably it's more important as you get older. When we were in residency and stuff, we barely, we didn't have time for girlfriends, let alone families, but some people did. I luckily I didn't, because I think it'd be hard. But as I went along my career, I got married, I had a family, and those things were important enough. I'd had enough, I think, advice from really good mentors that's stuff that needs to be prioritized. So I really kind of was thinking, well, how can I have better control over my time? And that was some of the decisions I made to go from full-time to part-time, so I could have a little better control over my time, maybe try to focus on certain areas of my practice that I felt like I could focus on better in that setting. But also really trying to make sure that if I had kids, I had prioritized, spending time with them pretty much over everything else, and we fit in the rest of everything. And that's worked well, because you can't just you can't have a family and expect it to just work. It's not, it has to be, it's like, planting a garden or whatever. You gotta nurture all that and spend time, and that's how you raise good kids and be a good dad and that sort of thing.
What advice do you have for graduating residents and fellows entering the professional job market for the first time?
I think it's always been hard, but it's dynamic, right? Things are very different now than they were when I went into residency. Unfortunately, I think just like everything, things like social media are I think young residents, we see this in our program, and our fellows, we see it. They're all they're using social media, and they see people and they think, man, that's the pathway. That happens a lot in aesthetic surgery now. It wasn't that way. And when I went into plastic surgery and through my residency, nobody, very few, maybe one or two people a year would just come out and do aesthetic or cosmetic surgery. Everybody did, they started off doing some recon and doing things like that, and they gradually built up aesthetic surgery practices. But now, it's different. And I think there are people they come out and they go straight into doing aesthetics. And I think you can do that. Some of my fellows that we've trained have done that, and that pathway is definitely legitimate, and it's no longer. It was kind of frowned upon 20 years ago or 25 years ago. You go take your boards and you just have aesthetic surgery cases. Oftentimes that didn't go well, but I think it's different times now. But it's tough. I think there's a lot of distractions. There's a lot of misinformation. The social media thing is, I think it's a net negative, honestly. I think that there's so many potentially, devastating things that can happen to somebody that takes one or two wrong steps on social media. So I think you have to be really, really careful. The other thing is that I think for young surgeons coming out, sometimes they see whoever they're, it's usually somebody they admire. Okay, they have this practice, they're in this city, I want to do the same thing. We see that a lot. People want to go, in Dallas, Fort Worth, for example. When I went into practice in Dallas, Fort Worth, I think there was total number of surgeons like 180, and I think now it's like 400. And it's there's more people here, obviously, and things like that. But my point is that I think you have to be a little bit flexible. You have to be critical about. You don't want to go to an area that you hate. Okay, that's not good. But there's probably multiple areas around the United States that would be suitable to most people. Now, and you ought to look for opportunities, because there's clearly, I see it all the time with our fellows. There's clearly, one place where they like, but the opportunity is clearly not as good. And there may be another place where the opportunity is so much better. And it's never a slam dunk, but I think they should do research, and they should really look at what's out there. It needs to be matched with what you want to do in life. If you love doing research and you're just going to go to a private practice position and there's no support, nobody doing research, it can be done, but it makes it a lot harder, versus trying to find. There's tons of, the Aesthetic Society, we have a ton of guys in private practice that do great research, So if you like that, you maybe find somebody like that that's doing it and can help you continue that. Or obviously some academic programs, it may be easy to do that. But you got to look at your opportunity, and there's no template. Sometimes one city may have some great opportunities one year, and then 2 years later, there's nothing there, but there's maybe a city 30 miles from there that has, fantastic opportunity. So I think you have to go into it with open mind. And, some people go in with the mindset, look, I'll be successful wherever I go. And that may be the case. I think, if you're good and you're, affable and you're somebody that can get along with people, you probably can go most places and be okay. But it's certainly easier if you go somewhere where there's a lot of opportunity and a lot of support. The other thing I think is really important is just the ecosystem in particular cities. I see it all the time. You go some places, it's like cutthroat, people hate each other, they're backstabbing each other. That would be a horrible place to go in the practice. That's one thing about DFW I have to say. Like, it's like, I'm sure that's somebody will hear this and go, oh, like, you're crazy. But it's a relatively amicable place to practice, even though we have a lot of people get along, we help each other, and I think we don't see a lot of that crazy stuff. Sometimes I see other places, but yeah, I'd stay away from that, because I think that would make your life miserable. So I think for young people, you got to be really astute. You got to look at your opportunities. Don't get one opportunity just because if they're going to pay what you think is a lot of money. Be careful. It's just like patients, right? We tell patients to do their homework, really make sure who's doing their surgery and what they're doing. Same thing here, and you mentioned there's some resources out there that people can help you evaluate these opportunities. It's not just about money. It's about the whole package.
As the newly elected president of the Aesthetic Society, what are you most excited about? And also, what type of resources are you providing to graduating residents and fellows?
Yeah, well, and this is even changing, but the Aesthetic Society, our why is that we educate. And that really has been what we've done for the past 55 years. And when I say that, what I mean is that, we do a lot of things in the Aesthetic Society, but really educating surgeons on the highest level of aesthetic surgery is our why we exist as a society. And so we have great educational symposia. I call them our vitamins. There are things like, we just had a nuances and injectable symposium. We have a breast and body symposium coming up in November in Arlington, Texas. We have a launching your practice symposia, which is in December. We have our face and rhinoplasty symposia, which is in January. And those are kind of our vitamins, which I call them vitamins because there are things that get surgeons through every day. It's like you take a vitamin every day and it gives you kind of the real nutrients you need to subsist the whole day or over your lifetime. It keeps you healthy. That's what these educational things are. And that's not like just going to 7-Eleven and buying a 4-hour energy, which gives you energy for 30 minutes, then you crash and burn. So these are things that surgeons go to every year. They're recurring. They're excellent. We have the best educators in aesthetic surgery in the world at the Aesthetic Society. And then certainly we have our annual meeting, which is I think by far the best a big aesthetic meeting in the world. And then we also biannually have a cruise, an aesthetic cruise, which is also quite good. This year it's in July. I think it's a Baltic cruise. But on our membership, especially young surgeons, we've changed a lot of things in the past 3 or 4 years, because it used to be that you had to not only be board certified, but submit a certain number of cases that you were doing. There are aesthetic surgery cases. So it usually took people, when I was there, probably at minimum 3 or 4 years, usually 5 to 8 years to get into the Aesthetic Society, because people were doing more reconstructive stuff early on. So that's all changed. No longer do people need to submit case lists. Basically, you do need to be board certified, but you can become a candidate member of the Aesthetic Society immediately when you graduate from your residency program. There's quite a bit of value to being a candidate member, including you'll pay the same meeting fees as an active member. You get access to a lot of the resources that we have. We have some resources that a lot of the residents use now, because they have access to called like Radar resource, attending a lot of our symposia, which a lot of the residents can do at either greatly reduced cost or no cost. But as a candidate, they have access to all those things. And then immediately when they get board certified, they can go into the process to become an active member. So within a half year, 6 months of being board certified, they can become an active member. Our fellows, there's an endorsed fellowship program in the Aesthetic Society. So like my fellow at UT Southwestern is an endorsed Aesthetic Society fellowship, but we have about 29 of these now across the Aesthetic Society. Our fellows actually are going to have even a faster track to get in. Again, it's predicated on them being board certified, because that's the one thing that it's a time thing, but they can become like a candidate. It's going to be called something slightly different, but we want our young surgeons to be able to have access to a lot of the great things we do at the Aesthetic Society. And I would encourage any young surgeon to, look in when you're a resident, come to a meeting. It's great. It's a great time. It's great socially, but it's also great educationally. And then once you graduate, become a candidate of the Aesthetic Society immediately. It'll give you a lot of value. It gives you access to resources if you need them. A lot of times sometimes people go and practice, and all of a sudden they're used to being in the residency. They got all these people to talk to, and then they go and they don't really have that anymore. So we have a lot of resources for people to interface with, people that they consider to be experts that have questions, or if they want to go. We do all this on-demand education now, so you can certainly on your own time look at things. So I would highly encourage young people to become a candidate member. Then obviously once they're board certified, you get right in and you become a full member.
As the founder of the Plastic Surgery Channel, how has it been going since inception, and where do you see it going in the future?
Yeah, I think that the Plastic Surgery Channel is really a media company, and I think we specialize in a couple of different things. The main thing is we believe that one of the things that we do as physicians is I think ignore our most our best marketing asset and our best intellectual property, which is ourselves. And so we help doctors deliver, high-end doctor-delivered video messaging on plastic surgery, and I think that helps the doctors connect with their community and patients. And so video now it's like why you're doing this podcast with a video, right? It's like video is rated across all businesses as your number one marketing asset. If you have a video on your homepage, you're 80% more likely to convert patients for surgery. So video is really important. And so we make it easy for people to get some video assets. So for surgeons, that's one thing. But we also are there for patient education. There's so much misinformation out there. We have a lot of experts that provide content and produce content through the plastic surgery channel, and we really want to give patients the right information, but also with programming that is somewhat, we call it edutainment, where it's a little bit entertaining to watch, so it's not just so boring. We also do work with some industry companies, kind of doing various things that they want to do. I think the plastic surgery channel is a great model. We're relatively small still, and we've done that purposely. We'd like to grow more in aesthetic medicine, and I just see us getting bigger, maybe expanding beyond not just plastic surgery, but probably first into aesthetic medicine. And then, there's other specialties. I think our model could be easily translated across other specialties, including things like dentistry, fertility, chiropractors, things like that. But right now we're just a little media company in plastic surgery.
We hope you enjoyed this episode of Interview with the Surgeon. Until next time, stay focused and keep following your dreams.